Polio is a disease the World Health Organization has worked to eliminate for more than 30 years. Dr. David Nabarro says if he's chosen to lead the World Health Organization, his goal will be to finish it off.
The last part of eradicating any disease is always the hardest part. If you don't do it, you lose everything. To do it, you've got to really bring all the energy and commitment that you can to bear.
For polio, the problem is access to children. The virus exists only in two areas, in northern Nigeria and along Pakistan's border with Afghanistan. Both are conflict zones where vaccine workers risk their lives to protect the children.
We must remain vigilant and focused till we're absolutely certain that the last case has been found and that we have got everybody protected.
Nabarro also wants to rid the world of guinea worm, a parasite that grows in the body after people drink contaminated water. In 1986, some 3.5 million people had guinea worm disease. Last year, only 25 had it. This was due to efforts of the United Nations agencies, the Carter Center, and the Centers for Disease Control and Prevention. Nabarro wants to make more inroads in ending malaria, a disease that threatens nearly half the world's population. There's been progress in controlling malaria in recent years. Still, more needs to be done. The WHO reports that nearly 500,000 infants, children, and adults died from this disease in 2015, even though malaria can be prevented and cured.
The purpose of this visit was to understand the nature of the outbreak as it is now.
During the Ebola epidemic, Nabarro visited the West African countries ravaged by the disease as the UN Special Envoy on Ebola. When people started getting sick in 2013, Ebola was new to West Africa, and no one was prepared to stop the outbreak. It took the world a long time to respond to the epidemic that claimed the lives of more than 11,000 people. Nabarro wants to make sure a tragedy of this magnitude does not happen again.
I want to be sure that the world as a whole helps nations to respond quickly when there's a threat of infection. Usually that means that the problem doesn't get out of control.
Nabarro has spent his life working in public health. He joined the World Health Organization in 1999 and has worked at the WHO and the UN since then. Now, he hopes to be elected Director General of the World Health Organization when the World Health Assembly meets in Geneva on May 23rd. Carol Pearson, VOA News, Washington.